Is it recording? Hi, Niluka, can you check if you can see the recording
Yes, I can see the recording.
Okay, okay. Thank you so much. Sorry for the hiccup. Yes, so this webinar is designed to equip communities and civil society with the practical skills needed to identify, access, and filter global fund data. This will enhance the ability of communities and at the national level, strengthening their engagement in both GC7 implementation and GC8 preparation. Karen, next slide, please. Okay. So first of all, I would just like to take you all through the ground rules, just to make sure that our webinar goes smooth for the 1 hours and for 1 hour and 30 minutes. So please everyone keep your microphone muted. And for this webinar, we have also providing the interpretation for the languages like Arabic, French, Portuguese, Russian, and of course English is the original language. So if you want to use different language, you know the drill. You need to go to the interpretation channel and select whichever language you want to use, and then you can mute the original audio so that you can then be able to hear. Yeah. So apart from that, if you have any questions or if you have anything which you want to share, you can either put it in the chat box or you can also raise your hands once the Q&A session starts. And like if you want that anything which you want to share but it's not the right time, please park it aside. And when you get the chance, you can share your questions over there. Apart from that, we will also encourage everyone to be engaged throughout the webinar. And please note that the webinar is recorded, so please introduce yourself in the chat box as well. Thank you. Regarding the objectives, um, the main reason for this webinar is to also increase community and civil society awareness of global fund data and access options, build skills to identify and use global fund data for oversight and program planning to implementation, and provide practical guidance on locate and apply relevant data to strengthen community engagement and accountability. Next slide, please. Yes. So regarding today's agenda, I will be, of course, I'm taking you through the agenda. Apart from that, we will be having overview of Data Explorer and case studies on geography, grants, and result, where our speaker will be taking you through the different case study scenarios and how we can identify data on the Global Fund website. So this will be like an overall presentation for us to get introduced with the data and like how we can then like identify data from the Global Fund website. And for that session, we will be having our host Jadmin, who will be taking us to this presentation. Apart from that, there will be a Q&A session which will be followed up by from our side, and then we will be having Emilomo, who will be taking us to intervention on how communities need to plan on using gender related data for country dialogue and funding request development engagement. Next slide. Then we also have intervention on how communities need to plan on using human rights related data source for country dialogue and funding request development engagement, that will be done by Alistair. And at last, we will be having intervention on how communities need to plan on using CLM data for country dialogue and funding request development engagement. This will be done by Susan. And at last, we will be having closing remarks from the Seven Alliance Consortium, as well as Karen Lama. She'll be taking us through the closing remarks. That's it from my side. Next slide. Okay. Thank you so much for that. Apart from this welcome and agenda, now we will be taking going into the main presentation. So for the main presentation, I will invite Jadmin Mostel. Jadmin serves as a data analyst on the Global Fund's Community Rights and Gender team. Her work focuses on utilizing data to promote gender equality, equity, human rights, and community-driven strategies, particularly for populations significantly affected by HIV, TB, and malaria. Prior to the Global Fund, Jadmin worked for Population Service International on the USAID President's Malaria Initiative Impact Malaria Project. Jadmin, the floor is yours.
Hi, thank you so much. Hi, everybody. My name is Jadmin, and I'm a data analyst at the Global Fund on the Community Rights and Gender team. And I'm very happy to be here with you this morning or afternoon, depending on your time zone. In this webinar, I will be discussing the Data Explorer, which is a public-facing product on the Global Fund website. We will hold for your questions until the end of the presentation, but please feel free to type questions you have into the chat. The Data Explorer is not a product of the Community Rights and Gender team specifically. Yes?
Could you please slow down so that our interpreter can interpret?
Sure. Sorry about that. The Data Explorer is not a product of the Community Rights and Gender team specifically. So it is entirely possible you may have questions that we cannot answer. If that is the case, we will record your questions and we will get back to you after talking to the owners of Data Explorer. So the structure of the presentation will be as follows. I'm going to give you an introduction to the Data Explorer through a live walkthrough. Then I'm going to walk through 5 example scenarios and where you can find the data. The first example will be a live walkthrough, and the remaining examples will be shown via PowerPoint. I will then give you a brief overview of the pre-packaged datasets. This is outside of the scope of the presentation, but I will show you where you can find the pre-packaged datasets on the Global Fund website and what kinds of data you can find within those pre-packaged datasets. And then lastly, we will end with questions. So if you don't mind holding for 1 second, I'm going to share my screen. Give me 1 second. Okay, I'm hoping that you can see my screen. If you cannot, please unmute yourself and let me know.
Yes, we can.
Okay, perfect, thank you. So this is the Data Explorer page. This is the Data Explorer homepage. This is the website for the Data Explorer. It's data.theglobalfund.org. And here you can see information that's not filtered by any country, by grant cycle, by region, by component. This is kind of all the information in one spot before any filtering occurs. I'm going to do a quick scroll down of the page. So you can see things like pledges and contributions. The default usually will be on the all, that meaning all grant cycles, but you can always toggle to a specific grant cycle if you would like to see only that grant cycle. You can toggle between multiple if you want to compare. And then you'll notice throughout the presentation, I'm often going to tell you that there's a download feature. The Data Explorer interface is nice if you want a quick snapshot of a specific data point or things like that. But if you wanted to do a more in-depth analysis, I would encourage you to download the data, and it'll download to an Excel or a CSV file, and then you can proceed to do a more complex analysis in those applications. Scrolling down a little further on the Global Fund homepage, you will see allocations here. Again, the default is on grant cycle 7. And you can also run your mouse over the graphic and other information will pop up. In this case, you get different allocation amounts by location, as well as the percentage of the allocation for that region, as well as the dollar amount itself, obviously. Scrolling down a little bit further, we can see grant budgets. If you highlight your mouse over each component, you can see the percentage of the budget per component. Again, the download button you'll see here, as it is in every graphic. Disbursements, we are going to walk through this graphic in a little bit more detail in one of the following scenarios. But as you can see here, all grant cycles are selected, and you can see that on the x-axis here that you have all years starting from 2002 all the way to the current, which is 2025, which would be this data point here. And you can see by component as well. Each line is one of the disease components, and you can highlight your mouse on different data points, and you can see the components, the disbursements by year. If you wanted to filter to a specific year, all you have to do is just click on whatever you're interested in. You can even click 2 of them, and then you can see it pop up to a more specific data visualization that you're looking for. At the very bottom of the home screen, you have expenditures. Again, the default is grant cycle 7, but you can toggle to 6 or grant cycle 5 if you would like. The default is usually on the percentage of expenditures by principal recipient, but you can always feel free to toggle to the $sign, and that will give you a dollar amount instead of the percentage. Here, I believe the default is that all of the principal recipient tabs are opened, but if they're not, that's no problem. You can toggle on the left side and open the different types of principal recipients, get a more detailed data breakdown of the different types of principal recipients and their expenditures. And again, you can always download the data. You'll also notice that you have a latest update date on most of the graphics, which is important to note. A lot of these graphics do get updated at different times, depending on what kinds of data they are. So if you are doing a more detailed analysis, you can kind of use these information to say, this is the data as of, the 3rd of November, 2025, which is always a useful piece of information to have. So that is the home page of the Data Explorer. We are now going to be walking through the first scenario. Like I mentioned before, I am going to walk through the first scenario as a live walkthrough, so you can see my screen, but then I will switch to PowerPoint for the rest of the scenarios, just for ease. And so I am going to read what the first scenario is, but I'm going to ask if Niluka doesn't mind, if he doesn't mind pasting the scenario into the chat so people can reference the scenario as we walk through it.
Sure.
So, thanks, Niluka. So the first scenario is the TB community representative of the Indonesia CCM needs to find specific financial insights of the GC7 TB grant in Indonesia. The CCM member intends to use these data to engage in a reprogramming discussion at the next CCM meeting. Where is this information available and how can the data be filtered? So, first, because we're looking at a specific grant, we're going to go up to the top of Data Explorer, and you're going to see here that it says Datasets, Geography, and Grants. And all 5 scenarios are going to explore at least one of these tabs. And in this scenario, since we're interested in grants, we're going to click on Grants. And it takes you to this page where it has all grants from very early in time. And so now we need to filter. So we know we're interested in an Indonesia grant. In this search bar here, you can either type the country name, you can also type the grant name. Even though we know what grant we're looking for the sake of this example, let's just type Indonesia. As you type it'll update automatically. And let's search. I don't know why it has other. This is also why we're going to switch to PowerPoint after this scenario. Okay, great. Now Indonesia popped up. So what you'll see here, if you scroll down to the bottom of the page, is many different pages of Indonesia grants. And the reason for this is because this is all Indonesia grants in the Global Fund, including those that are administratively closed. We are interested in this specific grant here, but for the sake of the presentation, let's say that the grant you're interested in is buried in many pages of grants. Let's go to the filter option here. So if you click filters, you're going to see many different ways you can filter through the information available to you. We are interested in the TB grant in Indonesia, one of the TB grants. I'm going to click component and I'm going to click TB. I'm also interested in only active grants in Indonesia. I'm not interested in looking at a closed grant. I'm going to go to status, and I'm also going to click active. And you can see here the two filters that I have applied, which are TB, tuberculosis, and active. And then it's very important that you click apply. And then what this will do is it will filter all of the grants on this page to only Indonesia grants that are TB grants and are currently active. So we're going to click on this grant here. We're interested in the MOH grant in Indonesia. And before we click on it, you can even see that there's some snapshot information. You can see the principal recipient, the start and end date, the signed and dispersed amount. But if you click on this, it's going to take you to the home page for this grant. So let's click on this grant. Now the resulting interface is for only the grant IDN TMOH. And the default for this interface is on the Overview tab, which you can see because it is in black here. We are going to toggle to the Financial Insights tab in a second, but let's stay on the Overview tab so I can show you what's on here. You can see the Fund Portfolio Manager, the grant status, the country, the components, as well as the principal recipient. You can see the dispersed, committed, and signed amounts. And you will notice here, there is still a download function here. So if you wanted to download that into Excel, you absolutely can. And then if you scroll down to the bottom, you will see the goals and the objectives of this specific grant. So that is all the information on the Overview tab for the specific grant. But we're interested in the Financial Insights as well. So let's click on the Financial Insights tab. Here is the information on the board approved dates, the program start date, as well as the program end date. You will also see disbursements and committed, and you can see the percentages as well. And you can see here the dispersed, committed, and signed figures as well. Scrolling down further, we get some interesting graphics. This graph is showing the grant budget aggregated into different levels. So we're seeing it split by health commodities, program management related costs, and program related activity costs, which you can see on the left side here in this dark blue piece of the graph, all the way on the left side. And you can see as you move right on the graph, you can see the different categorizations underneath the main category. So for example, if we're taking health commodities, equipment, and supply chain costs, if I highlight my mouse over it, you can see that the rest of the graph on the right side is highlighted as well. Those are the disaggregated subcategories of the health commodities main category. So say we're interested in health equipment. If I highlight my mouse over health equipment, we can see the part of the grant budget that is for health equipment. We can see that it's a little over 6 million. And we can also see that it is directly linked to health commodities because the graph is highlighted all the way back to health commodities and the rest of the graph is blurred out. And you can do this you can highlight your mouse over any part of the graph and you can kind of see the pathways and the categories and subcategories of each grant, as well as the information in terms of the grant budget. So this is a useful graphic if you have a specific question about, how much of the grant budget went to health equipment. You can go directly to this graphic and you can highlight your mouse over it and get that almost 6.2 million figure. Alternatively, you can always download the data and you can perform a more in-depth analysis in Excel, which is what you would have to do for a graphic like this because it is quite complex. If you scroll down further, we're going to see expenditure data for this specific grant. But instead of being broken down by PR, as you saw on the homepage of the Data Explorer, it's broken down by modules and interventions. So everything here are the modules in our modular framework, but you can click the arrows on the left side to see the interventions underneath each module. For us, let's just look at KVP as an example. So I can toggle on the KVP module right here. And underneath, you'll see 3 KVP interventions, children and adolescents, others, people in prisons, jails, and detention centers. On the right side here, you're going to see a breakdown in the percentages of the expenditure for each intervention and for the module. You can also toggle to the dollar amount as well. So if you wanted to see that, you can. And of course, you can always download the data by clicking on this button down here. So that concludes our first scenario, which is our live walkthrough I'm now going to switch over to PowerPoint to do the rest of the presentation. So let me stop sharing this screen and let me just share my PowerPoint with you. Okay. Okay. So next, we're going to talk about the second scenario. The second scenario is, at the next strategy planning meeting organized by the National Malaria Program, malaria communities need to discuss the current investments of the Global Fund in Mali and prepare a snapshot. Where can I find this information? So if we needed to look at a specific grant, that was what our first scenario walked through. We can always go to the Grants tab and locate the grant of interest within the search bar by either typing the grant name or by doing what we did, which was typing the country name and applying relevant filters until we could find our grant of interest. And when you click on the grant, the financial information of the grant will appear as shown in the previous scenario. But in this scenario, we are looking more at a countrywide snapshot of Mali. We're not necessarily interested in specific grant data. So in this case, we are going to navigate to the Geography tab at the red box in the top of the screen. And we're going to search for the country either in the blue box, which you can see highlighted in the center of the screen, or if you go to the bottom, you can find your country of interest, which is Mali in this case, which I've put a red box around. Either place will, either the search bar or clicking on your country of interest will take you to the same spot. So now we are on the Mali homepage. The default tab here is Overview, which you can see in the red box in the middle of the screen with the Overview tab in black. And there's information here such as the Fund Portfolio Manager, current PRs, the Coordinating Mechanism contacts, as well as former PRs. But we are interested in this specific scenario to look at the financial insights of Mali. So you can navigate over to the Financial Insights tab in the red box. And here the default is the total disbursements in Mali overall. And you know this because the All tab is highlighted in black within the red box in the center of the screen. The graph is linked to the tabs within this red box. So you can select any number of grant cycles that you're interested in if you want to limit the graph to a specific grant cycle or grant cycles. The graph will change depending on what is clicked. As always, you can download these data into Excel by clicking the arrow in the purple box on the bottom right hand of the screen. You can highlight your mouse on any of the data points, which is what I showed you as well during the overview of the Data Explorer homepage. You can do this by highlighting your mouse where I did, which is where the green box is on the page. And it will pop up with more information for that year. So for example, the mouse here is highlighted over the 2025 data points, and the resulting pop-up box notes disbursements in 2025 by component. You can download the data to Excel, again, by clicking the arrow in the purple box on the bottom right. If you scroll down further, you're going to see a very similar graphic to the one you saw before, but instead of a more broader graphic or specific by grant, you're going to see it as the country. So this is the grant budget of the country. You can click any of the grant cycle tabs to toggle between the grant cycles. You can see here that the default is grant cycle 7 because the box is in black. And as shown previously, you can highlight your mouse over any of the data here to see a pop-up box with more information. If you scroll down further on this page, there may be information about expenditures. Like in the previous graphic, you can click on any of the grant cycles within the top left red box to toggle between the grant cycles. The red box on the right demonstrates, again, how the data defaulted to showing the expenditures as a percentage, but you can toggle to the dollar tab to see the expenditures in dollars. You have the type of principal recipient, And you can have further details by clicking on each arrow within the green box. In this case, the name of the PR is shown. You can always download the data by clicking the arrow in the purple box on the bottom right. By scrolling down further, you're going to have a list of the grants within the country. So you have information such as grant ID, start and end date, geography, component, principal recipient, the status, the signed USD amount, and the dispersed USD amount here. You can click on any of the grant IDs to be taken to the grant homepage. So here, if we see Mali MCRS in the red box, it will take you back to that specific grant, and it will take you to the grant homepage that we walked through in the previous example. So moving on to our next scenario, I am a CCM member in Kenya. During the next CCM meeting, we will discuss key HIV, TB, and malaria interventions in our current grants. To prepare for this discussion, I need to look at the grant documents for Kenya. Where can I find these documents and how do I download them? You will navigate back to the Geography tab at the red box at the top of the screen. You can either search for your country in the blue box, or you can navigate to your country at the bottom of the screen, and both will take you to the same country homepage. Once you're at the country homepage, you can toggle to the Access to Funding tab in the red box. When you scroll down, the default tab will be on the current grant cycle, which is 2023 to 2025, but it can be changed to previous grant cycles if desired as well. When you scroll down further, you're going to see a list of documents. Here are all of the documents, and you can click on any of the arrows in the purple box to download the document. Here, we are clicking on the 2023 funding request for Window 3 TB HIV in Kenya. Once you click on that arrow and you download to your computer, there's going to be a folder of documents downloaded, which I've put a screenshot on the left of. The funding request form is on the right, and I access this by clicking on the funding request Word document form, which is, I've highlighted that with an arrow on the screenshot on the left. And so that is how you can find a document relevant to your country for anything that you're interested in. So moving on to scenario 4, while struggling with the current financial constraints in the HIV response, communities in Ukraine also need to advocate for more resources for the HIV response from the government. Where can community members access 3 years of HIV data reflecting on trends, focusing on dynamics of detection and treatment initiation to prepare a powerful advocacy brief for DRM advocacy? Like before, we're going to navigate to the Geography tab, and you can find the country of interest by either typing the country name in the search bar or by finding it within the list of countries at the bottom. Before we've walked through the Overview tab, and we've also walked through the Financial Insights and Access to Funding tab, but now we're going to go to Results. In the Results tab, you will find results aggregated to the country level. The default will be the most recent year, which you can see in the lower red box in the middle of the screen. You can always toggle between the years, which we are going to do. When you're searching for an indicator of interest, there are a number of things you can do to make sorting easier for you. For me, I like to sort by the component. This will aggregate each component together so you can see the list of indicators relevant to components grouped. So I did that by clicking on the green arrow, the arrow within the green box in the component section of the title of the table. Here you can see people on antiretroviral therapy for HIV. We're going to use this indicator as an example to see trends of data across 3 years. You can see here on the right side the result, which is just over 118 or close to 119,000 people in 2024. If we want to look at previous years of data to show trends, we can toggle to the 2023 tab at the top, which I've highlighted in the red box, and you can find the same indicator. I've sorted again by component, and I found the people on antiretroviral therapy for HIV. And I can see for 2023, the result is just over 117,000 people on antiretroviral therapy for HIV. Lastly, I'm going to toggle to 2022, and I'm going to find the same indicator in the same way by filtering in the component section and finding my indicator of interest. For 2022, we can see that the result is about a little over 121,000 people on antiretroviral therapy for HIV. And so by doing this, now we have 3 data points for 2022, 2023, and for 2024 for this specific indicator. And you can use these 3 data points together to show trends across the 3 years. So our last scenario, communities in the Northern African region are preparing a joint session on TB at a regional conference. Where can communities in the region access disaggregated data of the region on TB? And how can the data be filtered? This time, we're going to go to the top of the Data Explorer page, and we're going to toggle to datasets. I put it in the top red box on the screen. And then you're going to see there's a pop-up of 4 options. We're interested in the annual results box or tab, and I've highlighted that in the red box. So we're going to click on the annual results tab. Here there are a variety of ways to filter the data. First, you want to ensure that the reporting year is the one of interest for you, which you can see in the red box on the right of the screen. Now you're going to see that there are 2 filtering options on the left side of the screen, and there's a difference between the 2. The blue box in the bottom is only going to filter data below that filter. So the annual results will change, but the data points at the top of the screen, the 25.6 million, 7.35 million, and the 162 million that you see at the top, those will not change. So if you want to change all of the data on the screen, you will want to use the filter in the orange box of this that I put at the top left of the screen. If you forget this, that's okay. If you highlight your mouse over the filter, it's going to explain this to you, that filtering with the filter at the top of the screen in the orange box here is going to affect the data sets and the indicators throughout the entire page. I recommend you do this just so that doesn't lead to any confusion of filtering with the filter below and then having data above that filter that actually doesn't correlate to the filters that you applied. To avoid confusion, I recommend using the top filter. Here there are 2 filtering options when I click on the filter. You have geography and you have component. So for our purposes, for our scenario, I selected the Northern Africa geography, and I also toggled to the component section and I selected tuberculosis. So it's also important that you click the apply button after you select the filters. Don't click out of this pop-up because then the filters will not be applied. So click the apply button. Then the whole page will change. You can see that in the top of the page now, you don't have those 3 data points anymore. You have 0.06 million people treated with TB because you filtered to TB and you filtered to the Northern Africa region and you used the top filter on the page. So you know all the data on this page is filtered to the same qualifications. To see all of the data, you can scroll down on the page. And then you can download the data if you wish by clicking the arrow in the purple box on the bottom right hand of the screen. That concludes our 5th scenario, but I am going to show you where you can find pre-packaged data sets. This is outside the scope of this presentation, but there's a lot of really interesting data in there that are already extracted for you, and you can download these data to Excel or a CSV file. And you can perform more complex analyses if you wish using these predefined data sets. So anywhere in Data Explorer, you can scroll down to the bottom of the screen and you're interested in the data service link. It's kind of small, so I put a red box around it in the bottom and I put an arrow showing where that red box is. So you're going to want to click on this data service link. When you click on that link, you will be taken to this page. you want to click the Go button in the Downloads tab here. And once you click on that Go button, it will take you to Downloads. The default page is Report, but if you want to see the prepackaged data sets, you're going to toggle to the Dataset tab. So once you click the Dataset tab, you're going to find many prepackaged data sets that are already available for you to download. You can download them by clicking the arrow in the top right of each of the squares and follow the instructions, and it's very easy to download the data. You have a variety of data. These aren't even all of it. I just took a screenshot of the top of the page, but you have things like other results in a prepackaged data set. You have pledges and contributions. You can find grant budgets, really a variety of prepackaged data sets at your availability, which can be quite useful if you're doing a more complex analysis. So I encourage you to explore these data sets and get familiar with them and see what kinds of data are there that could be potentially useful for you. That concludes the walkthrough of Data Explorer. I'm happy to take any questions now, and I will stop sharing my screen so I can see the Zoom. So thank you so much.
Thank you so much, Jadmin. This was really helpful. I'm sure this will help a lot of communities who will be working on GC7 implementation, as well as who will be preparing for their GC8 preparations. This will definitely help them. But I would like to open the floor for questions or any kind of comment if you want to bring it forward to Jadmin, or any questions you want to ask from the participants. I see a lot of thumbs up.
Yeah, we also have a question on the chat. All data in Global Fund platform are linked with PUDR. Jamin, would you be able to answer that?
Yeah, definitely. So this is a question we actually asked the owners of Data Explorer as well. And they tried to link the data, especially the result data, to be the national level data that you would also find for WHO or other international organizations. But if there are specific data, maybe at a district level, or it's not as aggregated up higher, they would pull it from the PUDR, and that would be the information in the results section of Data Explorer. So generally speaking, they tried to keep it at a more international level that aligns with other international organizations, unless there is a need to go into the PUDR for the result-specific data.
Thank you.
I hope that answers your question.
Yes, thank you, Jadmin. We have Christine, over to you. Hi, Christine, can you hear me?
Merci, bonjour à tout le monde. Et merci beaucoup à Jadmin pour sa présentation sur toutes ces clarifications. En fait, j'ai juste une petite préoccupation concernant ces données. Bon, peut-être qu'elle a dit, mais je voudrais poser la question autrement. En fait, je m'inquiétais sur les données des perdus de vue. Et donc, avec tout ce que Jadmin nous a présenté, parce qu'elle a donné le chiffre exact des personnes qui sont mises sous ARV en 2024. Bon, est-ce que c'est y compris aussi tous ceux qui sont perdus de vue, ou bien c'est spécifiquement tous les patients qui sont mis sous ARV? Et si c'est dans ce cadre-là, est-ce que les données aussi ne relèvent pas aussi les perdus de vue? Parce que c'est souvent des nombres assez considérables pour les patients perdus de vue. Donc voilà un peu ma préoccupation. Merci.
If I understood correctly, I think you're asking about if there are, and what about the lost data in certain result data? Please correct me if I'm wrong. The data in the results tab is they take it from international sources. So it's the same data that the WHO or other international organizations would use. So I am not super keen on the specifics of the data themselves, that's definitely a question we could ask the owners of Data Explorer to see if there are missing data or other things that need to be highlighted where they get those results from. Please let me know if I missed a piece of that question, though.
Thank you, Jasmine. I guess as far as I also I was able to hear this question, I guess you were able to respond well to that question. Any last question from the participants, or then we can go to the next session? Okay. So thank you so much, Jasmine, for your presentation.
Hey,
It was
Jeremy here. Can
definitely
I
very
jump in and
helpful
ask
for
a
the.
quick question? Very
Sorry.
quick question. Jeremy here. Can I jump in and ask a quick question?
Yes, Jeremy. Over to you.
Thanks. Hi, Jasmine. Just want to say thank you for your presentation. I was just wondering, in some country, like for example, I'm from Malaysia, and we used to have the differentiated service delivery model for the key population. So is there any more disaggregated data to shows how much of the services is being received by different key population? I'm seeing there is MSM, there is female sex worker, but what about transgender and other key population? Can we like derive those kind of more detailed data from the result section that you have just gone through with us? Thank you.
Yeah, thank you for that question. I think it does depend on which country you're looking at. I would encourage you to look at the prepackaged defined data sets. That might have the information you're interested in. I wouldn't know off the top of my head which kinds of disaggregated data exist for each country. I imagine that data probably exists, especially because I know Global Fund likes to capture the disaggregated data for all key populations. So I would assume that the data would exist in perhaps the prepackaged, the defined data sets. So I would encourage you to explore there. But if we're still missing data, please feel free to reach out to me and I can connect with the owners of Data Explorer to see if there's a reason for that or if perhaps we need to add more data into the Data Explorer.
Okay. Thank you, Jasmine. And we also have a response from Jeremy that he got your answer. Okay, so we will now move forward to our next speaker. We will have Dr. Emilio, who will take us through the intervention on how communities need to plan on using gender-related data for community dialogue and funding request. So, Dr. Emilio is a medical doctor and researcher specializing in gender mainstreaming, bioethics, and sexual and reproductive health across Africa and Southeast Asia. Currently, she is a technical advisor, a gender CRG to the Global Fund. Dr. Emilio, over to you.
Good morning, everyone, or good afternoon, depending on your time zone. It's lovely to be with you here. I am Amy Lomo Ogbe. I'm a technical advisor within the Community Rights and Gender Department. And I hope you are all as excited as I am, or I have learned as much as I have from listening to Jasmine go through the Data Explorer and highlight how we can use that to collect data. Now, this session is going to be very different. We're going to be thinking through with you and opening up a discussion on how different kinds of gender-related data can be used to advocate for mainstreaming of gender equity and human rights issues in the funding request and during grant implementation. So I'm going to take a two-stage approach. I know many of you are very aware of related gender data, but I'm going to go through different sources of gender data beyond the data that the Global Fund has, and then think through with you about how this data can be used at different stages of the Global Fund grant cycle process to advocate for changes. Before I go into a lot of detail, and feel free to please raise your hand and send questions in the chat. I will look at them afterwards or ask a clarifying question as I go through my presentation. I won't share slides, but I'll be discussing and highlighting different points. Now, moving forward in the next grant cycle, we hope that we're going to have integrated equity, human rights, and gender equality assessments. So that means we plan to move from having standalone gender analysis, standalone human rights and stigma and discrimination analysis or equity assessments, bringing them all together, meaning that would be a pooled source. And also there's an encouragement that will inform national strategic planning processes. So that is also an advocacy tool and a political tool. So you know that these kind of integrated assessments will inform broader national strategic planning processes in your different countries. Now, many of you are probably familiar with different kinds of surveys and data portals that you can extract gender-related data, but I'm just going to highlight a few of them. And I want to say that these can be used for extracting gender-related data, but also human rights and equity indicators. So one I know you must all know is the integrated biological and behavioral surveillance surveys. Now, those are used, they monitor things around social demographic characteristics, sexual risk behaviors, knowledge of HIV and STIs, and experience with violence, stigma, and discrimination among different key populations. I think this data can be very useful in terms of understanding epidemiological issues, understanding risk, and be a great advocacy tool when discussing within country coordinating mechanisms, advocating to national and health policymakers as well. The other source of data beyond the data explorer that Jadmin has said is the UN Women has a data portal as well that gives you information on SDG indicators. You can filter that by region, by SDG indicator, and can be a useful tool as well for advocacy. Within the Global Fund, we have the gender equality marker. Now, this marker is very interesting, and it's also something that is used on every funding request across different regions that apply for Global Fund support. Now, why this tool is interesting is that it looks at every funding request and tries to assess the quality, whether the funding request was informed by evidence, so whether it used integrated equity, human rights, or gender equality assessments, whether it thought about the epidemiology of the populations, whether it engaged communities, and whether that information that was used is of good quality. And why I like this is that if the funding request had not used or taken into account inequality, epidemiological differences across different key populations and marginalized groups, the funding request scores 0. So knowing that this marker exists, engaging with country coordinating mechanisms and national and policy health makers to think about the impact this has on their funding request submission is very useful. It's graded between 0 and 2, and then it has this weight marking system to assess and identify if people don't use quality gender assessments to inform the funding request or integrated gender and human rights or equity intervention within the funding request. I see there's a question from Ro. Am I talking too fast? Okay. Do you want me to go back a few sentences or just slow down my pace? Okay, thank you. Okay. Also, familiarizing there in many countries, the World Health Organization does program reviews. They're also doing a lot of sexual, reproductive, maternal, neonatal, and child health reviews in different countries. There are program reviews for HIV, tuberculosis as well, and malaria. These again are opportunities to engage with national processes, advocate for a focus on gender equity and human rights issues, and use that information to inform advocacy processes. And finally, one other source is the OECD gender dashboard. It's a dashboard on gender gaps, and that can be a very useful tool for identifying and looking across different indicators and identifying relevant gender information. Now I have 5 more minutes. So during the second part, I'm going to go into more detail about the advocacy part, right? You have the data, but then there's thinking about how can we use that data to be able to ensure strong equity, human rights, and gender equality interventions in Global Fund grants. So we've kind of thought about dividing this into different stages. The pre-funding request submission stage. This is a wonderful opportunity to identify important actors, to engage with representatives of country coordinating mechanisms if you are not part of those yourself. I know there are in some countries we don't have standard CCM, so you want to engage with policy actors. That is the point where you can talk about two different things. One, what is the existing data? What is the case for integrating gender equity and human rights interventions? What's the current epidemiology? What are the issues? What are the barriers? What's the need for inclusion? And also, at that stage, you want to influence them if there's not an existing analysis that has been done in the last 5 years. You want to encourage them to do that analysis, have integrated assessments, use analysis to inform national strategic planning processes, and also inform the funding request. At that point, you could also mention the gender equality marker, that this is something that exists. This is something their funding request to be assessed by. And this is an important tool that they want to score and be able to show good quality funding requests that integrate community rights and gender concerns. Then the second part is in the funding request application. You want to ensure that you are engaging with stakeholders beyond the community representatives. You want to have had discussions with ministries of health, other important stakeholders that are going to inform the content of the national strategic plan and also the funding request process. You might be an SR or an SSR to PR that is leading that process. You want to have had conversations with them before that process starts and make sure you're aligned on specific goals and opportunities to integrate equity, human rights, and gender interventions. Then there's also the grant making process. I'm rushing because of time. So now funding requests have been reviewed. Technical review panels have reviewed this, and most times they're the ones that will highlight gaps in equity, human rights, and gender interventions. That's also an opportunity to advocate and then think about how we can ensure that they're addressing these gaps with relevant data and sources. And finally, in the grant implementation and reviews, you also want to use these opportunities as well as in reprogramming to say, if there's an opportunity to integrate or use, or if there's reprogramming or extra budgets available, to use that to focus on equity, human rights, and gender interventions. So kind of thinking about getting data, but how you use data. Data can be a powerful tool for advocacy. Using some of this information from the Data Explorer, these alternative data sources and portals to go into these rooms with charts, information backed with, of course, important equity, human rights, gender equality advocacy messages. So thank you for your time and happy to answer more questions afterwards, or reach out to me if you have further questions about data sources for gender. Thank you.
Thank you so much, Dr. Amilomo. Like, we are perfectly on time for that. I would open floor for questions. Anyone who would like to um, um, put any question forward to Dr. Amilomo? Dr. Amilomo, we have a request. If there is any presentation which can be shared with the
Oh,
participants.
so I don't have a presentation, but all those points I can put them in a slide or a document and share afterwards. So happy to do that.
Yeah.
And
So,
yeah,
yes,
any
please.
questions you have, please feel free to reach out. Yeah.
Thank you so much, Dr. Amilomo. So once we have the presentation coming from Dr. Amilomo, we will share it with the participants. We also have a hand raised from Nyan Win Fo. I'm sorry if
Yes.
I'm pronouncing your name wrong, but over to you.
Yes, thank you. Thank you so much for the information you provided, Amilomo. So apologies if I'm pronounced wrong, pronunciation your name. I just want to note that HRG related data that, like you mentioned about some kind of HRG related data like the violence or some kind of the gender related issues. So in GC8 prepositioning, it will be the essential data or just a optional in coming GC8 application.
That is an excellent question. Inyan,
Yeah.
did I pronounce your name properly?
Yeah, sure,
Yes.
correct.
Okay, great.
Perfect.
Okay, great. Okay. So, I mean, we just want to say that everything is preliminary because our guidance is yet to be published and will be published soon. But integrated equity, human rights, and gender equality assessments will be an essential part for high impact portfolios. So they'll be mandatory. Again, as I said, this is preliminary, but this is the expectation moving forward, and we'll publish guidance to support it. Secondly, I want to say, yes, this data is essential. It's not ad hoc because we have an internal monitoring tool, the gender equality marker, that checks to see if every funding request has been informed with a good quality gender assessment. So it expects the funding request to be informed by data. So I hope this answers your question. And all funding requests are assessed by the technical review panel to make sure that they've been informed by good quality gender equity and human rights assessments. So it is essential. Thank you.
Thank you so much, Marcy.
Thank you so much, Dr. Emilomo, for your presentation and also responding to the questions. Now we will go to our next session. For our next session, we have Alistair Saw, and Alistair will take us through the intervention on how communities need to plan on using human rights related data sources for country dialogues and funding request development. Alistair is a medical scientist based in Geneva, where he serves as the human rights advisor at the Global Fund. In his current role, Alistair supports country-led efforts to reduce human rights related barriers to health services for populations affected by the three diseases. Before joining Global Fund, Alistair held positions with CARE in Thailand and the Australian Department of Health in Canberra. Both focused on designing, implementing, and evaluating interventions to improve populations' health. Alistair, over to you. Thank you.
Thank you so much, and good day, good afternoon to everyone. It is so wonderful to see so many familiar names in the participant list, many old colleagues and old friends, and hopefully some future friends. I'm so glad that we're having this conversation today, and I'm glad to have been invited to emphasize really that epi data doesn't tell the whole story about what we're trying to achieve. Behind EpiData are people whose access to services depends on laws, on policies, and on social norms. And that's really where the human rights data becomes so valuable. It helps us understand people's experiences and whether they're actually able to claim their right to health. So I'm going to share just for a couple of minutes the types of human rights data that are available out there in the public domain. And much of it will build on the information that Emilomo has already spoken about, so I won't repeat anything there. And as I was trying to think about how to present this, I've been able to categorize the human rights data into 4 categories. So I hope that will help with this discussion. And as I speak, my colleague Niluka will share some of the data sources in the chat. So first, the first important data source for human rights data is community-led and participatory assessments. There are so many tools that exist that are either created or driven by communities and by civil society themselves. So we have things like breaking down barriers assessments. So these are assessments that have been commissioned by the Global Fund and implemented across 24 countries that have quite a significant human rights investment from the Global Fund. And all of these are available on the Global Fund website. And each country in this 24-country cohort has done an assessment every 2 years. So you can see changes over time as well. We have been working with communities, with civil society, and with national programs on malaria matchbox assessments. So most of sub-Saharan Africa has completed a matchbox assessment. There are 5 countries in Asia and the Pacific that have completed malaria matchbox assessments. And there are a couple of assessments ongoing in Latin America and the Caribbean at the moment. So I encourage you to find those assessments because they have a lot of valuable information in them. And if you can't find them, just reach out to us and we can share them with you. But of course, there's also the really important HIV stigma index and the TB-CRG assessments. These assessments capture lived experience. They capture real stories of stigma and discrimination, and they provide really valuable evidence and recommendations for change. And then finally, in this category of community-led and participatory data, we have community-led monitoring. And community-led monitoring continues to grow to quite a significant scale around the world, starting at subnational levels, but becoming part of national discussions on health programming. And it's incredibly valuable because it provides real-time feedback on whether services are accessible, whether they're being delivered with quality, and whether client and patient rights are respected as part of health service delivery. So this is really powerful data, all of these data sources, because they reflect what is happening on the ground and they reflect experience. The second category is policy and legal environment data. So looking specifically into laws and policies, how they guide the implementation or the delivery of healthcare, but also the people's ability to access healthcare. There's a really accessible website called the HIV Policy Lab that tracks different clinical, different system-wide, and different structural policies and laws across every country in the world. The website is very user-friendly, and you can search based on a policy, or you can search based on a country. So I encourage you to explore that website. There are also legal environment assessments. These are often conducted or supported by UNDP that really dig into the details of how laws and policies impact health. And looking at the policy or legal environment, we also have UNAIDS leading with their societal enabler indicators and their societal enabler targets. And they provide really important benchmarks and targets for removing punitive laws and reducing stigma and discrimination. So this data really helps us understand the policy and legal landscape, but where reforms are needed. The third data source, or the category of data, would be the programmatic and performance data. So there are a couple of really important sources of human rights data in this space. Of course, we have UNAIDS Global AIDS Monitoring, GAM, which does include indicators on stigma and discrimination. So it's information that's reported from national programs up to UNAIDS and then made into very accessible reports and data platforms. So please try and explore that, particularly the stigma and discrimination indicators. But we also have a lot of really important Global Fund data, and Jadmin started to introduce you to some of that earlier. Global Fund funding request documents include a question that require applicants to describe their approach to removing human rights-related barriers to HIV, TB, and malaria services. So you can quickly see the commitments that countries have made and the approaches that they're putting forward for Global Fund funding. But performance frameworks that many of you have been involved in contributing to, but also designing, include outcome indicators on stigma and discrimination, but also work plan tracking measures that look at many different CRG-related interventions. So with this information, you can start to really see the link between the human rights work and program performance. And finally, the fourth category I was thinking about was, I guess, the more external data to our programming. So human rights observatories and research that's being conducted. So regional and national human rights observatories are monitoring trends in the human rights environment, and they're often very specific to a particular right or particular population. But there are many that focus on the right to health for key populations, for women and girls, experiences of violence, violence against healthcare providers and healthcare facilities. There are quite a few different observatories that you can look into. And there are organizations like Human Rights Watch that document violations that affect health. And then, of course, there is so much academic research that is happening. A lot of it does focus on stigma and discrimination. When we think about human rights, a lot of the research focuses on stigma and discrimination, and perhaps less so on some of the enabling human rights programs like access to justice or legal literacy. But there is a lot of valuable information being researched, and there are some helpful journals you could look into, like the Health and Human Rights Journal, that provides some really interesting evidence that can be used for advocacy or policy change. So that's how I was thinking about the four categories of data that might be available and helpful. But the important thing is then, how do we actually use this data? And we need to make sure we're using it to design better programs. And that's by identifying barriers and then tailoring interventions. We use it to push for policy reform. Well, not me, but you in country, based on the needs that you've identified and based on community demand, because evidence is needed to change people's minds and change laws and policies. It can't be based on emotions drive a lot of the work we do, but evidence is needed to change the decisions that policymakers are making on a day-to-day basis. We need it also to guide resource allocation. We need it to prioritize funding toward human rights-based programming or human rights-based approaches and human rights programming. So the work around the healthcare system. And most importantly, we need this data for accountability, for making sure that we're tracking the commitments that have been made in country by governments, but also by civil society, and actually measuring progress toward creating an enabling environment for health. So that's just a bit of a summary of what's out there. I'm very approachable, so please always feel welcome to reach out to us at the Global Fund Secretariat through your learning hubs. And we can have more of a discussion on what might be available and how you can use it. But with that, I think I'll hand back to the chair and see if there are any questions. Thanks.
Thank you so much, Alistair. Just to save time, we will only take one question. If there are any questions from the participants.
There's one on the chat. I'll read it. Alistair, glad. Just want to know about data requirements related about climate change in GC8. Would it be essential or optional or specific components?
Thanks, Niluka, and thanks, Dr. Nyan, for always a tricky question to me. It's wonderful to hear from you. Of course, there are incredibly important interactions between the climate, between people, and between their health. So I would naturally expect that there would be a requirement to look into environmental data for GC8, for Global Fund funding requests, but really for the design of healthcare, because there is a huge impact on EPI, on movement, on people's health and well-being. I can't speak to whether there will be essential or expectations or requirements for GC8, but I would encourage you to look into the interaction between climate and health.
Thank you so much, Alistair. I will request all the participants to quickly turn on your cameras so that we can take a group photo and then proceed to the last session. स्पॉटलाइट हटा दें. Yes, मैं लास्ट से जा रहा हूँ. Okay. Yeah. 1, 2, 3. Smile, everyone. One more time. 1, 2, 3. Yeah. One last. Yeah. 1, 2, 3. Done. Thank you so much, everyone, for your photographs. Moving into last session, we have with us, just a second. Yes. Moving on to last session, we have Susan Perez. And Susan will take us through the intervention on how communities need to plan on using CLM data for counter dialogues and funding request development. And Susan, just a second. Yeah. So Susan currently serves as the Global Fund Specialist on Community-Led Monitoring within the Community Rights and Gender Department. She provides technical guidance on CLM across the Secretariat and coordinates the Gates Foundation-supported CLM Plus initiative, which provides implementation assistance to CLM programs funded by GC7 grants in a set of sub-Saharan African countries. Susan, the floor is yours. Thank you.
Great, thank you. Hello, everybody. It's wonderful to be here. I know we don't have too much time remaining, but I just wanted to share with you some thoughts about how CLM data can be useful in your funding request development process and engagement in that. I would just start off by saying that for those of you who are in country, you fit into many different, you serve in many different roles. You could be on the CCM, you could be a CLM implementer, you could be a rep on the CCM. You could be working with CLM implementers to use some of their data already in the areas that you're providing, carrying out your activities, whether it be sensitization or you're working as peers, etc. But what I would say is that for all of these roles, the most important thing at this moment in time, before the funding request development process kicks off, is to really understand and identify your CLM implementers on the ground, right? So that to me is a critical first step to just, understanding what type of information, who they are, what type of, and you may be some of them, right? And what kind of information are they gathering? And do they have any reports? And what do those reports actually say? So I think those to me are the first immediate things that would be helpful to do as we gear up for this intense process, which we know is going to be very difficult for everyone because of the likelihood that we will not have as much funding as we have had in GC7. The other piece, if you are a CLM implementer, it's very, very important that you really are ready to show your progress and your value. And by value, I mean, it's very clear that you have evidence that your CLM data has resulted in improvements in services, concrete examples of service improvements, and if that can be linked to increases in service uptake. So it's really trying to make sure that the value is there. So when conversations start to happen, you have a lot under your arm to justify why the work should continue in GC8. During funding request development itself, we know the process is going to be difficult, but one thing that would be great to do now is and when the schedule comes out in terms of meetings, is already map out where CLM data can be used in some of those meetings and engagements. And you will know because you will already have seen and understood what CLM is actually being collected. I would say CLM data can be used for several things. It can be used to help decide around geographic focus. based on where we're seeing barriers in access and quality to services, it can also help to focus on the actual interventions that need to be scaled up. Because if you see that your CLM data is showing that uptake in terms of one certain intervention along the cascade, your disease cascade, if there is slow uptake of that service from your CLM data, maybe that needs to be a focus in your GC8 funding request. So I would say it can be helpful not only for the geographic priority, obviously population priority, and the actual programmatic interventions that get selected in the funding request. I would say we also need to make sure that we are not reactive and need to scramble to get this data together. It's good to actually find it now and see what is useful and how it actually can be articulated. And if possible, it would be really good to invite the CLM implementer to those funding request meetings where CLM data could be presented, because they're the owners of this data. They are in direct contact with key and vulnerable populations. And if there's any questions during the CCM meeting, during these dialogues and engagements, they're the best ones to answer. I think it's also a good way to partner together with the civil society reps on the CCM and your CLM implementers who are supporting and making sure that the national objectives and targets are being met. Okay, the last piece, because I know we're running over time, the last piece is the budget, right? So you'll have to develop a budget. And we do have resources within the CLM library, which I can share the link with the organizers and have that disseminated to you. We have resources on how to budget, but I would say please rely also on the experience of the CLM implementers, because they know what has been necessary to operate a functional and effective CLM program. So we want to make sure that if when it comes down to it, hopefully number one, CLM will be in your narrative, and then will come the budget. And so rely on your colleagues in country to be able to help you with that piece. I'm available. I see my emails there with the other speakers. Feel free to email me. I know many of you, and we're very comfortable with each other, so do not be shy. I'll turn this over to Chinmay. Thank you so much.
Thank you so much, Susan, for the presentation. I would like to again open floors for the questions, if there are any questions coming from the participants. Any final call for the questions from the participants? Okay, so there are no questions for Susan. Thank you so much for your presentation. This is for the participants, like, you know.
نعم لدينا أسئلة.
Sorry?
ألو.
Yes.
بما أن المخصص للميزانية سيكون أقل من السنوات الماضية، كيف نضيف أعباء جديدة تتعلق بمواضيع لم تكن مدرجة في البرنامج السابق؟ هل لا تعتبرون أن هذا فيه تناقض بين أن تقلص الميزانية وأن تضاف مواضيع أخرى لها تكاليف؟ هل السؤال واضح؟ Est-ce que vous avez entendu la question? هل سمعتم السؤال؟ نعم. هل سمعتم السؤال؟
Susan, I'm sorry if you heard the question or like.
I did hear the question. It's a good one, right? I can't answer that. The funding request process is a country-owned process. So number one, if the country itself agrees that CLM is needed to monitor barriers to access and quality and availability of products and services, then the CLM and the communities will make that argument to do it. In some countries, they will, because it has been critical to increase uptake and improve health outcomes. So that will be very natural. In other places, it will be a battle to include it, because there will be challenging conversations to have in terms of what to prioritize. So I feel like your best shot is to make sure that your current CLM in GC7, you have one more year, is actually showing value. Because if it doesn't show value, it may not be prioritized. Because why prioritize something that has not shown that it has actually done something to improve services and to improve service uptake and health outcomes? So I just say we focus a lot on data collection, but we need to make sure that our CLM programs are shown to be functional, operational, and they're actually doing something. And maybe you'll have a chance in GC8. Thanks.
Thank you so much, Susan, for your response. As we are also short of time, I just want to put this comment that if anyone who is looking forward to the presentation or who wants the recording of this webinar, we will just request you to please visit the Seven Alliance Consortium website. If you just search Seven Alliance, mute. Okay. Yeah. So sorry, I was saying that if anyone who wants to access the recording of this webinar, you can reach out to us, or you can also visit Seven Alliance website, and you will find all the webinar recordings under the Learning Hub page. For now, as we are done with all the speakers, I would now like to invite Karen Lama, Communications Coordinator of Asia Pacific Regional Learning Hub by Seven Alliance, to do the closing. Karen, over to you.
Thank you so much. Thank you so much, Jamie. Thank you so much to all for being part of today's joint learning session on getting friendly with Global Fund data. Over past 90 minutes, we have valuable insight into how communities can identify, access, and apply Global Fund data to strengthening advocacy throughout the grant cycle from GC7 implementation to GC8 preparation. The examples shared today clearly show that data isn't just technical. It's a powerful advocacy tool that enables communities to speak with evidence, enhance accountability, and ensure Global Fund investment truly reflect community priorities. If we talk about our speakers, Jadmin took us through the Data Explorer sections like grant, dataset, and geography. Likewise, Amy Longo highlighted the gender equality and human rights data, which can be, she also mentioned that this can be found in UN Women website as well as WHO. Likewise, Alistair categorized the human right data sources into 4 categories, and one of them, which I want to highlight, is community-led and participatory assessment, which was done across 24 countries. And they also mentioned Malaria Matchbox in Thailand. Lastly, Susan highlighted the importance of identifying CLM implementers in the ground, as we will be engaging for GC8 funding request and many more. Thank you to all the speakers for your enlightenment session that we have today. And special appreciation also goes to all the regional learning hubs, Anglophone Africa, Francophone Africa, Eastern Europe and Central Asia, Middle East and North Africa and Latin America, and the Caribbean, for joining forces with Asia Pacific Regional Learning Hub to make this session truly global. And especially thank you to Niluka for always supporting us. Lastly, to everyone who participate, your engagement and questions have made this discussion more meaningful. We encourage you to take today's learning back to your national context, explore the data, explore that we shared, and continue to use data strategically in your country dialogues. oversight roles and community advocacy. As lastly, Chinmay mentioned, we will be uploading webinar recording and key resources in our website. So please do connect it with us. And thank you once again for your time and commitments. Thank you, everyone. And Chinmay, over to you.
Bye, everyone. Thank you so much for joining. Please stay connected, and you can find this on our website. See you guys.
Thank you.
Thank you.
Thank you.
Thank you.
Thank
Bye-bye.
you. Bye-bye.
Thank you and bye.
Bye-bye.
Bye.
Merci. Au revoir.
Bye. Thank you very
Okay,
much.
and bye.
Bye. Thank you so
Bye.
much.
merci
Bye.
شكرا
Bye.